Hi everyone, Steve Davis here from the Adelaide Show Podcast, and I've made a visit to Max Martin from iNform Health and Fitness Solutions. I would normally say Norwood, but we're at your Magill campus, practice, clinic?
Clinic, we call it, or studio.
Yeah. So you might remember Max, who used to do the Made to Move Minute, a special segment which ran about 10 minutes.
Correct. I don't think we ever managed to get one below 5 minutes. And by we, I mean I.
Yeah, exactly.
Yeah.
So here's the thing. I thought I'd pop out because you've got 3 of these locations now.
Yes.
And I thought it'd be nice if I helped introduce you to more of South Australia so that more people can move better. And so here we are.
This is kind of your area, huh? You'd be like a local boy around here.
Yeah, this is now my local iNform Health.
Right, yeah, that's right.
I used to be at the Norwood, now I've moved up here. This is the better one. This is your favourite too.
It is my favourite. It's kind of, it's got a great feel, and we've got the best team out of the 3 locations here, I would say.
Are you here?
Yeah, but that had nothing to do with it.
Yeah, of course.
Thanks for calling me out on that one.
That's right. So look, I want to introduce you to some locals you probably haven't met yet, and
so you know a lot of people.
Oh, I know just about everyone up here.
Yeah.
Follow
okay.
me. I'll
meet a couple of them at least.
I'll set you up.
Nice.
It's the least we can do for all the help you gave us.
Okay. Let's go.
Right, Max. One of the first stops here, very close to iNform Health at Magill, is the bowling club across the road.
Yeah, and you were chatting to everyone there. Like literally, you knew everyone.
I've got probably about 70 people interested in coming up there and getting their arm. What would you do with a lawn bowls person at iNform Health?
Look, firstly, one of the things that I love about the crowd that we just saw over there is they're all devoting time in the day to being active, being outdoors. So already we've got people that are in the right mindset to look after themselves and being in a good community.
Yep.
One of the things that I noticed, if you look at that bowling movement, there's a lot of pressure in the knees. They're bending quite a bit, so through the back. And you saw some guys that probably really struggled to bend down and pick up the balls of the ground. So, one of the things that we would work on is the flexibility and the strength and the balance, all of which would actually go towards improving their scores.
So if I wanted to improve my ball technique too,
there's probably other services that we could talk about for that.
I thought I'd surprise you by coming to the UniSA campus at Magill. Turns out you're actually a student here.
Yeah, I did my first year of university here. I actually studied a year of psychology before I started doing exercise physiology.
I didn't know you did that.
Yeah, no, so I've been analysing all of your little quirks over the last while.
Well, look, here's the thing. I still think there's people in there who need to go to iNform Health and Fitness Solutions at Magill, just around the corner. But they've got a gym here, so what's the point?
Okay, really good question. They've actually got a really nice gym, really good swimming pool. Probably the point for a lot of people is actually having the right program done for them specifically, that then they can apply, practice in their own gym. So we've got actually quite a few students from this campus that come to see us already. So this is perfect. We haven't met them today, so obviously one of the few people you don't know.
Yeah, give me their names afterwards.
We'll fix that.
We'll share notes.
And the lecturers as well.
What about the lecturers?
Yeah, look, I think especially the more academic, and this is, I'm going to make a stereotype, but the more academic the lecturer is likely to be, especially in the arts here at this campus, probably the less physically active that they will tend to be, a lot of time in books, that sort of thing. So actually a short walk down the road, beautiful location around here, come in, do a session that's tailored to them.
And you guys, with exercise physiology, it's all sort of university-based, evidence-based, isn't it? So if someone, say a lecturer from here, came down to be a client, would you make sure that you and your staff, every time you talked about different exercises, gave citations with footnotes?
We could do that. It would be laboursome for everyone involved, but we could probably do that.
Yeah, that's good.
Yeah, hopefully they would like to kind of refresh their mind a little bit and not have that happen when they come into exercise.
No, but it's there, isn't it?
But it's there for them.
Here's a promise. If you're a lecturer or a professor or an associate professor here at UniSA Magill, you get a session there, become a client, you will leave with a bibliography every single session.
References to everything we do.
Guaranteed.
Absolutely. It's a promise.
Max, you're probably staggered by how many people I've already introduced you to now.
Seriously, people just drive by and wave at you.
So there's even more.
Okay.
Even more. Look at
right.
all these cars coming along Magill Road. And by the way...
All your friends?
Yeah. They live around here. This is probably the nicest end of Magill Road to be driving on.
Yes, yeah.
Because it's a dog's breakfast at the other end.
Lower down. 2 proper lanes up here.
That's right. And I think these people, I know, they are conveniently located to you here at Magill. They should stop by. In fact, how does this feel? Would you roster your team to take turns to stand on the road, just stop them, and just ask people if they'd like to be able to move better without the use of their motor vehicle?
I think we could do that. We may last 20 or so minutes before the police come and pay us a visit.
Well, they could do with it too.
They could actually do
Yes.
with it. In fact, you know, a lot of them, with all the equipment they've got to carry, they do end up with a lot of low back pain, and so they would definitely benefit.
Yeah.
One of the things that we love about being here as well, Steve, is
Yep.
you get a lot of through traffic from the foothills. It's a nice kind of like avenue into the city.
Yep.
We've got showers, for example, so for people to come in,
Oh,
do a session, have a shower, get changed, keep going into the city for work without then having to kind of double back to go home.
Okay.
So it's really nice and convenient from that perspective.
do you mind if we have it? Well, I have a shower in a moment because I've got to go out tonight.
We've got 2 parallel showers in different rooms, so we could even have one at the same time.
Okay, that's good. Now, I just noticed in the corner here, there seems to be a GP practice. Now, would a doctor benefit from coming across the road to become a client of iNform Health?
Yeah, well, look, interesting, Steve. We've got a really good relationship with the GPs across the road here, and
Yeah.
we actually do see some of their GPs as clients.
Yep.
And not only that, we're building a really strong relationship where they're actually referring a lot of their patients as well, so that we can help them with those broader health behaviors, obviously their exercise, but also keeping in mind that here under the Move banner, we've got physiotherapists, dietitians, psychologists, podiatrists. So from an allied health team, we
Yeah.
can, you know, actually help them quite a bit.
And to finish on this, what's a physiotherapist? Like, that sounds really interesting.
A physiotherapist, that would tend to work a little bit further better down the coast. Physiotherapist.
Oh, is that what you said?
Yeah,
Oh,
it's
the
probably
charming
the accent.
It's the charming
A
accent.
physiotherapist.
Yes.
You know that shower? Forget it. I think you've killed the mood. We're done.
All right. God, they drive a hard bargain, but they're worth driving too. Yeah, was that nice?
That works well.
Lovely.
Okay, you're back on.
Okay.
All right.